Hello friends, my name is Dr. Vishal. In today's discussion, I'm talking about importance of gingival tissue graft. Let's look at the anatomy of gingiva. The top layer is alveolar mucosa. The first dotted line is mucogingival junction. In between two dotted line is attached to gingiva. Then we have free gingiva, and then in between the two teeth is interdental gingiva. There are so many reasons that can lead to loss of attached gingiva. The reasons could be age, faulty brushing techniques, malocclusion, abnormal frenal attachment, oral habits, and irritations. With the help of the animation, I'm going to show you how trauma can lead to loss of attached gingiva. So how are we going to get back this attached gingiva? So in treatment, we have two types of treatment options. One is non-surgical treatment option and second is surgical treatment option. In non-surgical, we have correction of the teeth brushing technique. Second is removal of masochistic habits. And third is correction of malocclusion. In surgical treatment, we have pedicle soft tissue graft procedures. Then we have free soft tissue graft procedures that include epithelial or gingival grafts. Second is epithelial, subepithelial connective tissue graft. Then we have alloderm, mucograft, and acellular dermal matrix. In today's discussion, we are going to focus on epithelial or gingival grafts. So benefits of free gingival grafts are as such. It prevents further gingival recession, ensures the health of the teeth, creating a protective barrier of strong, healthy gum tissue. It reduces the risk of gum recession due to a thin gingival biotype. So let's look at the indications of free gingival graft. The first indication is to increase the zone of keratinized tissue around natural teeth and dental implants. The second is root coverage and root sensitivity issue. Third is aberrant frenum pole reduction. And the last one is to deepen the vestibule for prosthetic purposes. Let's look at one by one. So I'm going to show you some of my clinical cases that I have treated during my private practice. So the first indication is increase the zone of keratinized tissue around natural teeth. This is one of my patients was referred from restorative dentist to increase the zone of keratinized tissue. If you are comparing with the ideal picture, patient was missing attached keratinized tissue. And patient was wearing a partial denture. So the steps that I take it is I thoroughly numb the palate where I'm taking the tissue from, and then I mark the outline. And then once I mark the outline, I start to harass the pharyngeal graft from the palate, and then I put the Surgicel around the surgical site for the hemostasis. Then I transfer the graft to the desired site and then stabilize the graft with the help of the silk suture. I add a couple of sutures on mesial and distal aspect of the graft and make sure the graft is stable. So in 1 week follow-up appointment, this is how it looked after 1 week follow-up, that the entire graft was took it in. And after 2 years of follow-up, the result was still sustained and I was able to see the constant sustainability of the result, and I was very happy with the way the result came out. Again, let's look at the before and after picture. As you can see, the result was quite astounding. Let's compare with the ideal picture. Yes, I was able to gain the keratinized tissue and the patient was happy too. The next case is increase the zone of keratinized tissue around dental implant. It's very important that the dental implant should be surrounded by thick keratinized tissue for the longevity of the dental implants. The choices that one, you can incorporate the free gingival graft tissue during the implant surgery, or the next thing is that you can incorporate the free gingival graft after the osseointegration of the implant. So this is my patient was missing number 20 area, came for a restoration of number 20. So I planned for the implant surgery, along with also I planned for a free gingival graft. I opened up the soft tissue, prepared the osteotomy, placed the implant, grafted some bone graft, and added some free gingival graft along with that. Secured the graft with the combination of silk suture and vicryl suture. And this is the after osseointegration of the implant. This is how the result looked. This is the buccal view. As you can see from the picture, the implant was surrounded by thick keratinized tissue. This is the healthy situation around the implant site. Let's compare with the peri-implantitis. You don't want your soft tissue look like this on the right picture. You want your implant to be surrounded by healthy tissue. Okay, so next indication for free gingival grafts are root coverage and teeth sensitivity problems. This is one of my patient was having a sensitivity issue. Whenever the patient was drinking cold water, was complaining about pain and sensitivity. So this is the occlusal view. As you can see from the occlusal view, the mesial root was exposed. So I planned for free gingival graft and designed the flap. Open up the flap, curated the roots, and harvested the graft from the palate. Secured the graft around the side with the help of vicryl suture, added a couple of extra sutures for the snug fit of the graft. This is the result after 1 week of healing. And after following up with the patient, this is the result that was sustained over the course of 6 months. And let's compare before and after. Yes, I was able to gain the keratinized tissue and the patient was not having any sensitivity problems after the pharyngeal graft surgery. Next indication is aberrant frenum pole. My patient was in pain because of the thick labial frenum pain, because of the thick labial frenum pole. This thick frenum pole patient was also having a root recession around the lower anterior area. So I planned for a pharyngeal graft surgery and opened up the flap, curated the roots of the teeth, and harvested the graft from the palate. Secured the graft with the help of the silk suture, and this is the 1 week follow-up appointment. And then I followed the patient for over the follow-up appointments, and the result was sustained after 1 year as well. So this is the how patient was initially, and this is when he received the pharyngeal graft. The result looked quite well. Patient was not having any pain, and also I was able to get rid of the frenum pole. Last indication is to deepen the vestibule for prosthetic purposes. The long-standing edentulous cases can lead to severe resorbed jaw, and the patient keeps on complaining that the dentures keep on coming out. To deepen the vestibule, to get the room for the flanges of the prosthesis, the treatment option is pharyngeal graft. Patient already had the implant placement done, so I opened up the flap, harvested the graft from the palate, and secured the graft around the area of the implant. This is the facial view. Unfortunately, in this case, I don't have the follow-up appointment pictures, but I saw the case and the case came out beautiful. Patient had a space or the vertical height for the flanges of the dentures. So to conclude my presentation, the indications for pharyngeal grafts are as such: to increase the zone of keratinized tissue around natural teeth and dental implants, root coverage and root sensitivity problems, aberrant frenum pole reduction, and the last one is deepen the vestibule for prosthetic purposes. I hope everybody liked my presentation. If you have any questions, please write down in the comment section. Thank you so much.